Hi, and welcome back to another episode of Talking Points with Preferred Health Magazine. Today we'll be speaking with Dr. Blessen Abraham. He's a chiropractor at the Brunswick Health and Physical Therapy Center in New Brunswick, New Jersey. And we're going to welcome him to the show today. We'll be speaking about back pain and chronic pain, and more importantly, how we go about treating our pain and what are the benefits and some treatment that we can use to better take care of ourselves. So let's welcome him to the show. Dr. Abraham, welcome to the show. Nice to meet you.
Thank you for having me.
So we wanted to talk about back pain specifically today with you. Obviously, this is something that doesn't go away. I feel like the topic of back pain is never ending. Somebody's always suffering.
As long as we live and breathe, you're always going to find someone with back pain. Pain is so common. It you can have from a teenager all the way through an adult. It can be something new, something prolonged, something that came and went away and then comes back again. There's so many different variations of back pain these days, but it's so common. And now more than ever after COVID and during COVID, back pain is even more prevalent.
Right. And I was going to say that too. Here we are. Now we're stuck in the house. We're trapped to our desks. We're working from home. We're not able to go to the gym. We're not really exercising. We're not taking those walks. Since COVID came to town, I'm sure you've had an uptick in chronic cases.
Oh, we've been very busy since COVID came along, and post-COVID, it's been even busier because now that people have been afraid to leave their house with the back pain, now they're coming out and now we're treating them even more. Back pain is something that we all live with. Regrettably, we shouldn't have to live with. It's something that's treatable, that's actually could be fixed. Different ways of fixing it. One, if it works for one person, not necessarily works for the other person, but there's different ways we can fix it.
And now a lot of us just assume that we'll take some naproxen, we'll take an Aleve, a Tylenol, and we'll be okay for a couple of hours. And then here it comes back, and we're kind of in the same cycle daily. Can you tell us about the dangers of treating ourselves that way?
So taking a medication recommended by a doctor or just taking something over the counter can help in a few cases, but you have to think of the medication as a Band-Aid. It helps cover the pain, doesn't treat the pain, doesn't make it go away. It just makes the pain a little bit more comfortable. The pain still exists. So take an ibuprofen for a day and the pain goes away, great. Taking the ibuprofen or naproxen or something out of the medication over a certain time, you're just masking the pain. There's something going on. You need to follow up with a doctor to find out exactly what's going on.
How can someone even decipher whether that back pain or neck pain isn't just related to stress or if it's something more serious?
Again, you need to find a professional that can actually diagnose you. You need to find a doctor or someone that is actually can treat you with this pain and diagnose and tell you, okay, you're stressed out. That's what it is. There's nothing going on internally with the muscle or the spine. All right, let's treat it this way. Or they get an MRI or get an X-ray. Hey, we found something. Let's change our treatment. Now we know what's going on. We're going to change your treatment. We're going to do something different. This medication only masks your pain. Let's get you some kind of therapy or maybe some kind of invasive injection or invasive procedure to fix what you have.
Now let's talk about what you specialize there at your practice. I know you're also a physical therapist center as well, right?
Yes. So we do chiropractic and physical therapy. So the chiropractors we have on staff, we try to focus on the spine area, diagnose what's going on also in the extremities, meaning the shoulders or the arms or the legs. We then refer it over to the physical therapist because we feel the physical therapist has the best expertise in working with those joints. So as a team, we try to work together. And there's other medical doctors we work with in the area that we all work as one team rather than, all right, this doctor's going to treat this doctor's going to treat this, the therapist's going to do. No, we work as a union, try to get the person better as fast as we can.
That's wonderful. Have you found that the patients coming in with this kind of pain get younger and younger, where some people might think that's a person older who's had kind of deterioration over time, but it's not anymore?
Kids, and let me take it back, younger adults are now more and more active doing sports and things that they're prone to getting more injury. I remember as a child, I would say I had back pain. My mom would just brush it off. Oh, don't worry about it. You'll be okay tomorrow. Now kids are doing 3-4 sports at a time, plus schoolwork and everything else, and the training. They're prone to getting injured a lot more than we were when we were younger.
Absolutely. Absolutely. What would you suggest someone do to maybe help themselves, stretching exercise? What can we do?
Stretching is one of the best things. I tell all my patients, every single one, old, new, doesn't make a difference. Stretching is the best thing you could do. Try to stretch. Find stretches online that can benefit to your pain. There are plenty of stretches, and there's not like one stretch for the back. There's probably hundreds of stretches you could do for your back. Find them. They're easily available on the internet. I can give you a list of places to find them, but everything's different. I would recommend you finding a stretch that works for you, that's safe and stable. Because one thing, you don't want to hurt yourself while you're stretching.
Right. By overexerting yourself, trying to get something down.
Yes.
And how long, how many times a day would you say something like this is important?
I would probably say 3 or 4 times a day, like 2 sets.
Really?
Yeah. Because it's really important. Stretching does a big thing. It's something that is overlooked by a lot of people, but it's so valuable to the body.
That's true. Now I have a couple of videos which I'll show too of you doing a few exercises that would benefit someone with back pain.
Sure.
Danielle sent me some over, so we'll put them up for everyone to see. But what other exercises, what are the exercises that you suggest?
Exercise, I would do low impact stretching, anything that has support. As we're getting younger, when we're younger, we think we have that Superman complex. We can do as much as we can, but we don't think long term some of that exercise we did back then could affect us later on in life. Okay. So anything we do with stretching or kind of support is what we need. You're lifting, use a belt, use a bench, use straps, do a lot of stuff, cardio. It's not a bad thing.
Okay. All right. And when do we come to someone like yourself for treatment?
So listen, you're the best.
Time.
you guys, your body better than anyone else. When you feel like you're in pain and you don't feel that pain going away in day 2, day 3, it's at the same level, it hasn't changed, or it's getting progressively worse, go see the doctor. The longer you prolong it, it's harder to fix. The quicker you come in, the quicker you're going to be better.
And what kind of treatments do you do? Do you use TENS, like as far as electrical stimulation, or? So
we use TENS machine. We use ultrasound. With a TENS machine, we do combo therapy or even Russian therapy with that. We also do some manual therapy. We do the chiropractic adjustment. There's a lot of, we have the traction tables also. So there's a bunch of modalities. Is
there a certain ailment, I guess, that people come into to see you for most? Like, what is your most?
Most is always going neck pain and back pain, and majority it's back pain, low back pain.
Okay, and that's from the sitting in something.
That's from sitting, doing stuff around the house where they shouldn't be doing, gardening.
Oh,
now that's a big thing right now.
That way last week, actually, the gardening.
And we had a lot of people come in for gardening injuries. I'm like, okay, we need to stop landscaping for a little bit.
Guilty.
Yeah, we all do it. It's something you can't avoid it.
Though we all do. These are all just common, situations that we're all in, whether it be sitting in a chair in an office or gardening or sports, for instance, like we mentioned before. How do we avoid that? Is it unavoidable?
It's somewhat unavoidable, but you have to be aware of our surroundings and what our limitations are. Okay. If we're 25, we're not 15. If we're 45, we're not 20 again. Right. So we have to take everything in small pieces. Just keep aware of what our limitations are. That's it. And again, once you feel like, okay, I need to stop, take a break, take the break. It's not embarrassing. Just do it.
I think that's what a lot of people have a problem with, right? They say our body is much older than our brains. So. Always.
I feel like I'm 17. I sure as hell don't look it.
I think my husband was breakdancing last week, and I was like, you shouldn't be doing that. Oh, so that's good. All right. Well, tell us, how can we get in touch with you for treatment and for consultation?
Well, you can always call us 732-565-1701. And you can always email us at frontdesk@brunswickptcenter.com.
And that is the website as well, correct?
The website is www.brunswickptcenter.com.
Okay, excellent. Well, thank you for coming on today to speak with us about back pain. I'm sure we'll be hearing more from you, and we'll be talking again, maybe on another topic, but this is something that will never really go away, unfortunately.
Mm-hmm. No.
What can you say just before you go about just the chair that we're sitting in even? Is there something that we should?
Listen, the main thing is everyone's different on a chair. The main thing is you need to be sitting in the chair properly. As you can see, I'm leaned forward.
Okay.
Bad. I need to sit back. My head needs to sit back. That you need a proper back support on a chair. Even if it needs to be tilted forward, we need to have that kind of support, because now I'm too far away from my computer to type. So now I lean forward.
Right. That's what I'm doing. I'm the same way. If you could say, I'm not even, I have a pillow back here, mind you.
Right.
To support myself.
Support your low back, but now your whole top body is moved forward now.
Right.
So
you have to see this chair. I literally have something under my desk as well, so I could step on that. I try the best I can.
That's what COVID did. We're trying to do the best we can, and because of it, I'm seeing more patients, regrettably.
Right.
In pain.
Right. And younger. Okay. Well, let's get them to you if there's anyone listening right now and they have any kind of back trouble, big or small. Let's get you in to see Dr. Blessen Abraham right away for treatment.
Thank you.
And we thank you for coming on Talking Points Preferred Health Magazine. We'll speak to you soon.
Thank you very much. Bye-bye now.
Have a great day. And thanks for tuning in again to Talking Points with Preferred Health Magazine. A big thank you to Dr. Blessen Abraham for sharing his expertise with us today. For more about back pain and how to cure it, please visit www.brunswickptcenter.com. And tune in next week for another episode of Talking Points with Preferred Health Magazine. Talking Points with Preferred Health Magazine is sponsored by Patient Preferred Physicians and Practitioners, a network of top doctors and healthcare practitioners, as well as the Preferred Professionals of America, Surfside Realty in Boca Raton, Florida, and the Melissa Billy Clark Show.